Okay, guys. So we looked at kind of scene safety and some of the things to consider, and then some of the clues or that you might want to think about as you're approaching um, a potential victim. The next thing is the primary survey. So this is once you've decided that it's appropriate to help, how you make a decision, how you assess the patient, so you know what to do next. Okay, so the point of the primary survey is basically to figure out if the injury the person has is life threatening. Okay. And in a life threatening situation, obviously we're calling 911 and we may have to intervene with CPR. Okay. So before you actually begin the primary survey, we kind of need to know whether we should use it or not. And the way we do that is by checking responsiveness of the patient. And it's really, really simple. It's basically just trying to get to a response out of them to see if they respond to your command. Because if they respond, that automatically tells you a couple of things. So you will say something like, "Hi, my name is Mr. Cuthbert. I am CPR certified. Can I help you?" Or "I am first aid trained. Can I help you?" Now, if they give you an appropriate response like, "Yeah, please, it hurts," we don't need to worry about the primary survey anymore. Okay, because that tells us enough. If they are talking, that means they are breathing. Okay, so for you to be able to talk, you have to be breathing, you have to be conscious, you have to be aware. So if they respond, then at that point, we can go beyond CPR. Now, if a situation arises where they start that way and then deteriorate, CPR might need to be done again, and you would go back and redo the primary survey. Okay, let's imagine that they are unconscious, or there is an inappropriate response, like they can't answer the question, slurred words, grunts rather than vocalizing a response. Then we're going to start the primary survey, which is what I wanted to teach you guys about today. Okay, so primary survey is ABCs. Airway, that means is there a passage from the outside world into your lungs? Breathing, are they using that passage to take air in and out? And is there circulation? Okay, is blood circulating around the body? Okay, it's a little bit more than pulse. So we call it circulation. So ABC, airway, breathing, circulation. Okay, so the first thing we want to assess is airway. Now, the protocol that I'm looking at here um, is slightly different from the CPR protocol that I was going to give you in person. This is a little bit more in depth. Okay, so with the American Red Cross, they don't actually fully check the airway. They do bits of it, but they don't fully check it. But I'm going to teach you the full way, show you the full way today. And then if when we get back to next year, I manage to run like an extra CPR course for you guys, which is something I've been thinking about, we will adjust and show you the other way. Okay, so now if you're checking somebody's airway, that means you're getting close to their mouth where saliva is present. You want to have a barrier. Okay, so gloves are important. Okay, so you want to make sure that the airway, i.e., the mouth and nose, are open. And we do a maneuver called head tilt chin lift, which is basically shown in this picture here. You have the palm of the responder's right hand pushing down on the head and two fingers under the jaw lifting it up. And basically that opens up the airway in the throat. Okay, if you tuck your head all the way under, it starts to shut off your airway. I'm just showing my bald head right there. But if you're in that situation, it's closing off the airway. It's harder to breathe. Okay, so opening the airway to give them the opportunity to breathe. Now, this is where it's slightly different. In a full medical primary survey, if the airway is not clear, you would do what we call a finger sweep, which is basically putting your hands in the mouth, sweeping through to make sure there's nothing blocking, like something they've eaten that's blocked, or if there's facial injuries, loose teeth, etc., that might be blocking the airway. Okay, a tongue. For American Red Cross, they don't finger sweep. Okay, now you can see why it's important to use gloves. Okay, with children, we only sweep if we see an object that is blocking. So if you look in the child's mouth and you see an object, you would sweep it out. Okay, so how do we assess breathing? You want to set yourself up in the situation that this responder is, which means to the side of the head, as close to the face as possible, with ear over nose, looking down the chest. Okay, we do three things when we're checking for breathing. We listen for breathing, we feel for breathing, and we look for breathing. Okay, and this breathing check lasts about 10 seconds because we want to give them an opportunity to demonstrate breathing. Typically, when you are healthy, you will breathe at least once or twice within that 10-second window. Okay, so the ear you'll see is close to the mouth and nose, so you can hear the inhale, exhale. Breathing does produce a sound. You will feel expiration as you breathe out. You'll feel the air exhaling the person on your cheek. Cheek is very sensitive to touch, so you'll feel it there. And then we're looking down the chest. Okay, and what you'll see is chest rise and fall if breathing is present. Okay, so if all of those are missing, that means the person is not breathing. Okay, now if the person you find is lying face down, it's hard to do that, right? We don't want to turn them at this point. Okay, we want to prepare to turn them, but we want to check their breathing first. So the first thing you would do is place your hand on the patient's back. Okay, by putting your hand on the back, you can feel that chest rise. And then you're going to put a hand close to the mouth as when they're lying on their front. Okay, so if they're lying sort of face down, you put your hand close to the mouth so that you can feel the exhale, the escaping air. Okay, so the last thing we want to do is check circulation. So this isn't just pulse. If they are breathing, they have circulation, because breathing takes muscles, and for muscles to work, there has to be blood circulating through them. If they are coughing, that takes muscles. Okay, that's a muscular action to cough. So if coughing is present, they have circulation. If they have movement, okay, again, muscular contraction. The last thing is taking a carotid pulse. So we practice doing this in the first semester, actually in both semesters. Okay, so we can take pulse on the person on the carotid artery to see if they have circulation. Now, with the Red Cross, why it's slightly different is they don't check circulation. They just check breathing, and they make it really simple. Because if they're not breathing, there's probably no circulation. Now, there is a couple of situations, short windows, where that's slightly different, but in general, that's a really good way to look at it. Okay, if they're not breathing, the heart's not beating. Okay, so you can cut the primary survey short if at all in this moment they start to talk. Okay, or they start to move, they start to cough, then you can just move on. So basically, the primary survey is designed to help you make a decision to begin CPR. And if they show any of those things, then you know that they don't need CPR. Okay, so the big thing we're looking for is if they fail these things. So if they're not breathing or you see the airway is blocked, you don't find circulation, then we need to begin CPR. So if no signs are present, airway, breathing, circulation, you're going to begin CPR. Okay, and this is going to be on a hard, flat surface. Okay, you can't do CPR on a bed because then the bed gives instead of the person. Okay, it needs to be hard and flat. If they are prone, that means lying on their front, you do need to carefully turn them. Normally in class, I would show you what a log roll looks like, but that's not something that we can do right now. If they are unconscious, so non-responsive, but are breathing and have circulation, all you need to do is monitor them and watch them and keep checking those vitals in case they stop breathing. If at this point they're lying on their front, you do not turn them. Okay, you only turn them if you need to give CPR. And we talked in the last video about having a spinal injury and wanting to protect that. If anybody is unconscious, you want to kind of treat them as if they've had a spinal or a head injury, which means really carefully when you move them. Okay, and protecting that head. All right, that's the end of this video. your next assignment after watching these videos is to write a flow chart of what you do. Okay, so the steps you go through scene safety, the steps you go through the primary survey, and then after that, I will have another video demonstrating what CPR looks like. All right, speak to you guys soon. Bye.